When someone walks up to me and tells me that they can barely get through the grocery store and that they have to lean on the shopping cart the entire time to manage that pain and that leg heaviness that they're getting, but somehow leaning hunched forward on that shopping cart decreases that stress, I already know what their MRI report's going to show. That shopping cart lean is one of the most clinically specific signs in all of lumbar spinal stenosis. It's called neurogenic claudication. The pain and the heaviness in the legs that you feel that comes on when you're walking and standing upright, and that's immediately dramatically relieved by leaning forward on that shopping cart due to flexion. The level we're probably talking about that's being affected in you and your body is L4, L5. L4, L5 is the most common level for central canal stenosis in the lumbar spine. It is the level where the spinal canal is typically the narrowest and where posterior elements, the facet joints and the ligamentum flavum, are the most compromised when they start to break down structurally. When they start to get arthritic degeneration in there, the compromise gets even greater. So if you're feeling this, if you're seeing this, L4, L5 is probably part of your pattern, and you should listen and watch this video, because today I'm going to give you the top stretch that I think is equivalent to that shopping cart lean that helps to alleviate some of that stress and heaviness in your legs. So keep watching. My name is Dr. Ali Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And my mission is to help optimize your living potential so that you're living the fullest potential you can on a daily basis. The one thing I'm going to ask you to do is I'm going to ask you to like this video. I'm going to ask you to subscribe to this channel, because I'm going to continuously put out videos that's going to help educate you on how you can live a much more optimal life. Now, let's understand the anatomy of the L4, L5 area and where we're going to with this stretch that I'm going to show you that's going to be a game changer for you. I'm going to explain 3 facts to you on why this stretch is one of the best stretches out there for L4, L5. Fact 1, the central canal is the most at risk for L4, L5. The lumbar spinal canal is not uniform in its diameter across all levels. What does that mean? So the lumbar spinal canal is not uniform in its diameter across all levels. And what I mean by that is that as you go down that spinal canal, the diameter gets smaller and smaller, and it's extremely small around the L4, L5 area. And so when you throw in degenerative changes like ligamentum flavum thickening, so if you see that in an MRI report, facet joint hypertrophy, you see bone spurs, that now makes that area even smaller and creates a bottleneck. Fact 2, bilateral compression of the L5 nerve root. So this is important to understand because the L5 nerve root exits from both sides of that canal there. And as in an L5S1 foraminal stenosis where it can only be affected on one area, this central canal stenosis affects both areas. That means you get symptoms in both legs, bilateral heaviness in both legs, bilateral claudication, bilateral tightness and stiffness. Fact 3, the flexion extension principle at L4, L5. The L4, L5 central canal is exquisitely sensitive to the flexion extension position of the lumbar spine. In extension, upright, standing, lumbar lordosis is maintained. That's the curvature in your lower back. The posterior elements buckle inward, the ligamentum flavum holds into the canal, reducing the available space for the neural structures to a minimum. Okay. Now, in flexion, that's the forward lean. The lumbar lordosis is reduced. So that means that that curvature gets reduced and you start to get straighter in that lower back. The posterior elements spread apart, okay? The ligamentum flavum is then tensioned and pulled away from the canal, and the canal opens to its maximum available width. This is the mechanism behind the shopping cart sign. This is totally the mechanism behind the shopping cart sign. So what do I mean by that? When an L4, L5 stenosis patient leans forward on that cart, that lumbar spine moves from extension into flexion. The canal opens. The canal opens, therefore there's less stress on that nervous system. That neurogenic claudication immediately improves. It is a direct mechanical decompression that you go through postural flexion. That's the game changer. So the exercise I'm going to show you is called the double knee to chest, and it achieves maximal lumbar flexion in a non-weight bearing position. That is why this is such a great stretch and one of the top stretches for L4, L5. And then I'm going to show you a rocking variation that adds a dynamic mobilization component that is strategic to help with this area. So let's talk about this. The double knee to chest with a rocking variation. So first one, phase one, is just the static hold. So you're going to be lying on your back. Draw both of your knees simultaneously towards your chest. Both knees, not one, both. This bilateral draw is clinically significant because the L4, L5 central canal stenosis compresses the canal bilaterally, both sides. That's why you want both knees working at the same time. The single knee to chest rotation, which I've shown in the L5S1, was a specific movement for that area. But in L4, L5, when you're talking about a central canal stenosis, this needs to be symmetric, bilateral decompression. And so you're going to then clasp your hands around the shins below the kneecaps. And that's where you're going to hold this. You're going to draw the knees in until you feel that lower back pressing flat against the floor. Now, very important, okay? You're not pushing this too hard. That flattening and that lumbar lordosis is being reduced, okay? The flexion opens up that canal. You're holding for 30 seconds. Breathe slowly and deliberately, but allow gravity, allow your body to naturally move into this position. With each exhale, feel that lower back sink, okay? Fractionally more into the floor as you progress. The posterior elements start to release the muscles, the structures and stuff. Now, the relief you're going to feel in this position should be immediate. You should recognize it. Anybody who suffers with L4, L5 central canal stenosis is going to see this as being a great relief. Your legs are not carrying your body weight. That's why you do this stretch, and you're doing this because it's not weight bearing. The disc is unloaded. The posterior elements are available without having any stress on there. That's why this is such a great stress for L4, L5. Now, watch me as I show you how to do this. The double knee to chest. It's a static hold, very simple stretch to do. Basically, what you're going to do is you're going to go onto your back. You can do this while you're in bed on the mattress. You can do this on the floor. Basically, you're taking both your hands. You're gripping underneath your knees, gripping both legs, and you're bringing the knees to your chest, but you're not forcing it. You're allowing gravity to do all the effect and the motion, and it will bring it closer to your knees as you're breathing in and out. Gravity will do all the work for you. Static hold for the recommended amount of time. Very, very simple. Now that you've seen that variation, now let me show you the rocking variation, but let me explain to you what's going on here. After holding this for 30 seconds in the static position without releasing the knees from the chest position, you are going to begin a gentle rocking movement. Okay. Now that's very important. Just a gentle rocking movement, rolling the body slightly to the right, returning to the center position, rolling then to the left, and rolling back into the center position. The amplitude of the rock is small, okay? Not much, 5 to 10 centimeters of lateral movement. That's it. The pace is slow. 1 full rock cycle every 2 to 3 seconds. So you're not going back and forth vigorously, extremely slow. This clinical mechanism makes that rocking variation so important and comfortable. Both knees being held to the chest, the lumbar spine in full flexion, and the lateral rock produces a small rotational movement at the L4, L5 area. This is compressing and then decompressing the posterior joint capsule. This alternating compression and decompression drives the clearance of the inflammatory mediators, the cytokines, anything inflammatory in that area from the L4, L5 posterior joint capsule out of it. So that's why you're doing the rocking motion after you're holding it for a static position. 10 slow rocks, then return to the static hold for another 15 seconds, and then you release. You're performing this about twice daily, morning and evening. The double knee to chest, static hold with lateral rocking, okay? So, very simple. Basically, you're going to be on your back. You can do this if you're on a mattress, waking up in the morning. You can do this on the floor, on a yoga mat. Basically, what you're going to do is you're going to bring both knees to your chest. You're going to be grasping your fingers and you're going to be holding below the knee, and you're going to let gravity do all the work here. Breathing in and out, because as gravity does the work, it will bring it closer to your chest. And then a lateral rock. And the lateral rock is not a huge amount, just a gentle rock side to side. See that? I'm not moving a lot. So, phase 1, static double knee to chest, 30 seconds. Low back is flat, lower back is flat, bilateral canal opening is what's happening. Then you move into phase 2, gentle lateral rocking motion. 10 slow rocks, L4, L5, posterior joint capsule clearance is what's happening. The shopping cart lean on the floor without the cart. What this stretch cannot address, though, is that it is important to help improve what's going on there, but it doesn't replace any care that you should be receiving. So that's an important thing to also add if you haven't been adding it. So I tell clients that if you're doing your stretches, it's going to help. But if you're not seeing somebody for therapy, then you're only getting half the benefit, and you may only see half the results or temporary results. When somebody comes in to see us, we are actually working on that spine as a chiropractor. We are adjusting that spine. We are taking pressure off those nerves. And that is something you can't do alone with a stretch. That is something you need a practitioner for. So the cumulative effect of joining that chiropractic care with that stretch gives you a more meaningful progression, a long-lasting progression. So when we're talking about this amazing stretch, it works around the structural narrowing of the L4, L5 canal. And remember, the diameter is the narrowest there. Throw in ligamentum flavin thickening, throw in things like arthritis and stuff, you now have a more compromised state, and you need to do this stretch. That is important. The facet hypertrophy that may exist too, the arthritic degeneration, read your MRI report and see if these things are existing. Facet hypertrophy, ligamentum flavin thickening, seeing bone spurs, degenerative disc disease and stuff. All these play a role in terms of how far along the path you may have this. And that's an important thing that anybody who comes in to see us, we may want to see an MRI report because we need to understand how limited is this? How structurally damaged is this? There is still progress that can be made with the therapy as well as the stretches, but it also guards our expectations to where we know we can get to. And that's important. So there's always a role for imaging. And if you want to understand what imaging can be shown on an MRI report, watch my videos. I talk about it there on your MRI reports and how to read it. So 1 stretch, 2 phases, and do not forget your care that you may need, the clinical layer targeted through L4, L5 with chiropractic. My name is Dr. Ali Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And before you go, make sure you like this video. Make sure you subscribe to this channel because I'm going to keep on putting more and more videos out. And I'm going to keep on serving you and showing you how you can optimize your health. Looking forward to seeing you in your next video.